Hello, everybody, and welcome to the Healthtech Pitching Podcast, where we take a deep dive into the week's best health tech stories so you don't have to. I am, of course, delighted as always to be joined by my colleagues Holly and Amy from the SomX team, and we're going to break down some really interesting stories, I think, this week on a range of topics, some UK, some US, and some with broader appeal, shall we say. Amy, Holly, how have your weeks been?
Oh, it's been quite a busy week, Hugh. Short week, but we had a bank holiday, so it's pros and cons that we had an extra day and then catching up this week. But yeah, I can't complain too much.
Just an extra day that you have to fit in somewhere else around the other 4 days, right?
Exactly.
How about you, Holly?
It's gone really quickly, but yeah, much the same. Very busy, but yeah, we've made it through the tranche of bank holidays in May, so forward to some 5-day weeks.
You look forward to that?
Yeah. Well, then you don't have to cram work into 4 days, do you?
Yeah. Okay. Got you.
Okay, well, fantastic. Let's round this week off. As most of our listeners will know, we're recording on a Friday, so that probably explains the output that we're giving today. So, okay, with that, let's move on to the first of today's 3 stories. So, the first of our 3 stories today comes to us from Digital Health, and that is that Amazon-style prescription tracking has gone live on the NHS app. Interesting, and I think an exciting development for what is ultimately quite a key service. Prescription tracking feature has been rolled out in the NHS app to reduce unnecessary calls and visits to pharmacies. It's going to roll out to nearly 1,500 high street chemists, including every Boots pharmacy in England. And it's expected to be made available to nearly 5,000 more pharmacies over the next 12 months. There's a lot in here, including benefits to both patients and staff, pharmacists in particular, and a big focus on freeing up time for pharmacists to spend more time on things like delivering the Pharmacy First scheme, which rolled out last year to much fanfare. So, question, Amazon-style tracking, is this something both of you have been after from, I guess, your prescriptions from your NHS app? How long are you spending in the NHS app every week?
Wow, what a question. Well, I don't actually have any prescriptions at the moment, so perhaps not targeted at me. But I did think when I read this that what I really like about this is it's quite obviously it's not I'm sure the integration has been hugely complex, but what it's solving is a relatively simple problem, and it actually reminded me of when Uber was developed. They obviously developed Uber to provide transport to people, but one of the key reasons that they developed it was to remove the uncertainty of when your taxi was going to arrive, and that was a key feature in developing obviously the tracking where you can see your Uber ride coming, and remove that kind of paranoia that you have or that worry about where something is and how long the journey takes. And I love that they've used that in this instance to actually just kind of alleviate that worry from people who might be wondering where the prescription is. In the piece, they say almost half of phone calls to community pharmacies are from patients asking if their prescription is ready. So it's really that people are sitting there worried. Let's alleviate their worries. Let's tell them where it is. Let's give them a time frame and just kind of remove that part. So I think it's a really nice example of identifying quite a simple, almost behavioral aspect of people worrying, waiting for things, and finding a way to alleviate that, and at the same time streamlining processes and all of the extra stuff that comes with it. So that was my immediate thought when I read it, which I think is brilliant. And I think it's great, but I haven't used it myself. Although on the back of reading this, I did download the NHS app again because I haven't used it in a while. So I was trying to figure out how I would potentially find this feature, but you probably have to have a prescription to order to actually see the feature live. So yeah, I don't know, Holly, have you had a chance to see any prescriptions on it yet?
No, I think much the same as you, Amy. I do actually have the NHS app, and I do find it incredibly useful. I think particularly for um, you know, booking like appointment reminders, or actually earlier this week I was using it to check like which GP I'd been to before. So I think it's definitely I definitely find it useful from that perspective. But no, it's much the same as you. I don't have any active prescriptions currently to track on it. That being said, obviously know people that do. So yeah, it'd be interesting to see kind of what this looks like in real time. But yeah, I mean, I think it's definitely is one of those things where we think it's as you said, Amy, a very simple problem to kind of fix, and you sort of think why. I'm glad it's kind of arrived now, and I think as people sort of become used to that idea of, I think they reference in here about tracking kind of food delivery, and much the same as tracking parcels and things like that. I think it's I think it's brilliant.
It also makes me wonder about what other integrations could we get in the NHS app. Um,
Mm.
What's the limit of what we can actually add into the NHS app itself? Is there a limit? So that also raised another question in my mind. But it sounds like, yeah, addressing the almost like the I don't want to say simple, because it's not a simple problem, but there's something quite sort of human about this problem, where it's a service, it's sort of service delivery issue that can be fixed. And I wonder if if there are more additions of that we will see coming over the next years, months, years, to combat like these kind of service delivery issues, which is great. And they say in the piece, by harnessing the power and efficiency of modern tech, we're saving patients time, driving productivity, and freeing up pharmacists to do what they do best, which is exactly what we really want at the end of the day. We want more time for pharmacists to actually be there advising on more complex issues, not answering the phone to say your prescription will be ready tomorrow.
Mm.
So yeah, I think it's really positive, but it did make me laugh a little bit that it's and harnessing the power and efficiency of modern tech, given that that feature of Amazon has been around for quite a few many years now. But I'm not knocking it. I think it's brilliant. But yeah, modern tech, perhaps a little bit of a stretch, I think.
As you said, what was Uber? 2009, 2010, possibly earlier.
Yeah. So little bit behind, but we're getting there, and that's really positive.
So especially from kind of the admin perspective, I think they obviously talk about here about pharmacists taking phone calls, and I think we talk about it. Obviously, this isn't necessarily AI as such, but talk a lot about using technology to free up that admin burden and kind of streamline processes. And I think this is a brilliant example of that, where, as they call it, as you said, Amy, modern day tech is supporting with that. I guess one thing that actually I wondered with this, which I guess obviously we wouldn't know, not being able to kind of see it in practice, is what that kind of process looks like for pharmacists. Obviously, they're going about their day-to-day prepping the prescriptions, but what for them, what does this integration look like? Is it still going to be updating things on a computer to send those notifications? And is that how is that kind of admin going to weigh up against taking these phone calls? Obviously, imagine phone calls are a lot more timely, but yeah, I'd quite, that kind of leaves one big question in my mind as to what this actually looks like in practice for them.
But I mean, a lot of the points we've discussed on here raise some very interesting questions off the back of this release, of this news generally. And I think it taps into, what does this process look like for the pharmacist? What does it look like for the patient? And interestingly, also into that whole, what, Amy, you said, you haven't actually got the NHS app at the moment, and you haven't used it in a really long time. Holly, you do have it, but you're interested to see what new integrations could come. And I think there's very interestingly a big roadmap of things, but there's almost that little bit of disconnect and little bit of lack of integration, and also that slight variation in terms of what's available at any given time and what that looks like for anyone as well. I know I had the NHS app I definitely don't anymore, because I think my GP at the time didn't have a lot of the integrations that other GP practices did, and other systems did, and other records did. And even as we look at this news, it's very interesting that they've gone, there's 1,500 pharmacies that are rolling out with this integration now. So for those pharmacists, I imagine it's sort of a very similar process. It's that inventory stock taking thing. There's that integration between their kind of inventory systems and ordering systems and the NHS app. And I think that's obviously really, really impressive, really important. Again, the modernity of it feels like a catching up element, right? It still does. It's very interesting that they say including all Boots stores in the UK. Now, I had a look because I'm obviously a dogged reporter on these things, and there are 1,800 Boots stores in the UK, which probably aligns with the exact number of pharmacies that have already rolled this out this time at 1,500 in England. So this, I'm really keen to understand whether this is just Boots stores now, because it makes it feel like it's a wider thing. And I'm wondering about what does this process look for other pharmacies that aren't Boots? What is it for the smaller community pharmacy, or for pharmacies working under Echo or Hayden's or anything like that? How long till they get this? And I wonder whether that's still sort of a bit of a problem with the NHS app at the moment, which is for different patients with using different services with different practices, those integrations are going to look quite different. And I still feel like there's a problem as we go forward as to whether we're rolling this out at the right stages equitably. I think pilots make sense, but this feels like it's a thing only for Boots at the moment. I'd love if anyone wants to jump from NHS England wants to jump in and correct me on that. I'm keen to hear it. But should we be waiting until we've got more on board? If this seems like it's a partnership driven announcement, i.e., they've got Boots on board, so they launched it. Do we need to focus more on having like more on board every time we roll out a feature?
That's interesting. I guess Boots has got Boots is a sort of household name, so it's a good way to launch it. It's a good way to announce it and get people's buy-in. So perhaps they've launched with that, and there's others in the pipeline. They do say that there's more. There are other high street chemists involved, and that there will be like 5,000 more over the next 12 months. But that doesn't quite match up with the numbers side. Although the thing about the barcode was quite interesting, that you don't have to be registered. So the prescription tracker allows people without a nominated pharmacy to use a barcode. So I guess that means that you could use it with because you'd still have to integrate that with the pharmacy. Maybe there are still some questions about how that integrates elsewhere. If anyone knows, please let us know.
With that, we'll go on to our next story. Our second story comes to us from Moby Health News, and that is that Hinge Health has gone public, raising $437.3 million in its IPO. So, digital musculoskeletal care company Hinge Health went public earlier this week on the New York Stock Exchange, raising nearly $450 million and selling 9.14 million shares. 11-year-old San Francisco-based company provides musculoskeletal support through coaching, surgeon access, and decision support, as well as a wearable that helps relieve pain. It's taken them 3 years to go from the announcement where they said we intend to list to actually listing. And the first day saw a relatively positive outcome. They closed above their intended launch price. So that can only be a benefit. Interestingly, obviously this article's from Moby Health News. TechCrunch went with a slightly different angle, which is Ever the Optimists saying Hinge are just one in a line of companies that are actually raising at a public valuation much lower than their previous private funding round. So, what does this tell us about the market? What do we think of this news?
Well, I think the contrasting opinions is, I mean, obviously they've IPO'd, so that's
good.
positive
Yeah.
in itself. And the fact that they've raised some pretty big rounds, to be honest. So and they've got a good line of partnership deals, commercial deals with big companies. I think Teladoc and Amazon Health Services, MIDI Health. I think it shows that there's definitely an appetite for I mean, on the commercial side of these large agreements, and perhaps that is stemming from more focus, more awareness on prevention, and giving people access to physiotherapists, and especially for musculoskeletal health, which we are seeing as on a global level, rising rates of issues with musculoskeletal health problems, which could be from a number of factors. But I think the way that definitely our working culture has shifted in recent years has actually lent itself to causing quite a quite an array of issues with musculoskeletal health. I know that certainly in the UK, the GP appointments for musculoskeletal health have the highest out of any other reasons for people seeing their GP. So back pain and neck pain, really kind of having that strain on healthcare. So yeah, I think yeah, I the commercial opportunity here is great. I do wonder about saturation of the market with this kind of technology. Like, how many technologies can we have before it becomes, a little saturated? But I guess the unique point of with Hinge is that they also have the wearable device, which is quite interesting. So it's also having that additional treatment angle. But yeah, it's I'm interested to hear your thoughts, Hugh.
Yeah, I think for me, this is a lot of testament from the MSK side of the value of platform solutions and having something that's really kind of bigger and more extensive. Hinge have built something of an empire here, and it is really impressive. And I think taking this to IPO kind of it does suggest that there is demand for this. There's backing and belief in this, and it's probably a good indication, at least for the MSK market as well as the kind of wider health market. I do wonder whether this kind of outcome is replicable for solutions outside of the US. These are giant services, and Hinge has been going for 11 years now, and it's continually built and built and built. It's almost the kind of it's the poster child, basically, of of a well built um, single clinical focus, but with a kind of broader platform built around it, sort of in the vein that companies like Flow are looking at in the women's health market of acquiring and developing new services. So it does make me wonder from an outcomes perspective, is this replicable elsewhere? Like, are MSK services in Australia, the UK, Europe, could they ever reach this level of success? I think that's something we probably have to keep an eye on. I'm not sure whether the model and the markets can be compared.
I think you're right. I think it's just the way that the US health system and insurance works. It is a very different model. And whether that can be replicated, I think the issues still remain across countries in terms of the health issues and demand. But yeah, the kind of commercial pricing is going to differ massively from country to country, and also how we see that in the NHS. One of our clients, Equal, has also a digital musculoskeletal health company, have multiple partnerships across the NHS, and that's a very different model to what we're looking at here, but still essentially serving a very similar need. So yeah, interesting what this means for other similar companies, and how this might impact other tech companies, especially in this space. And again, that kind of saturation part, I'm not. Yeah, I'm interested to see how this will kind of evolve.
I just checked the most recent price. Where I think so. For full details, they listed on the 22nd, and it's the 30th of May now, and the price seems to be hovering around that same mark. So obviously, only a week and a half of difference, but you've got to watch all IPOs these days, particularly in the digital health space. It's hugely positive news that a company of this kind can publicly list. But I think we've seen from previous experience what can happen. I think it's really positive though, that particularly in a kind of slightly rocky market at the moment, driven by obviously external factors. That Hinge is hanging nicely around its opening, or well, its first day closing price. So really positive
Mm.
news, and I think the valuations thing is it's interesting, but it does draw a kind of a kind of question between that VC valuation thing. What things are valued at the private market versus what they are valued at on the public market, and I think there will continue to be a slight disconnect there. Obviously, positive that people are going public at all, though, and it is real testament to how things are. I'd say at least slightly shifting versus the last couple of years, where there's been at least one or two cancelled IPOs and some slightly rocky starts for companies doing this as well. Holly, any thoughts on this one?
No, I mean, I sort of echo what you guys have said. I think when I was, having a look at this, I think from my perspective, definitely very positive news. I mean, it's always obviously great to see an IPO in the digital health space. But yeah, I think back to what you said earlier, Hugh, about TechCrunch's report. I was having a look kind of at, it's obviously been coming out quite a lot on LinkedIn, and so people are always going to have very differing opinions about what this means for the sector. Some positive, some not so positive. But yeah, I think it's definitely good to see. And obviously, we're only a week or so since then. But yeah, interesting to see kind of how it plays out, obviously across the US, and then obviously what that means for companies in a similar space over here too.
Fantastic. And with that, let's have a chat about some of the companies that are raising and are picking up cash over here in the UK. On to our third and final story. Our final story comes to us from UK Tech News, courtesy of Startup Coalition, and that is that UK health tech startups are worth £32 billion, says a new report. Startups in the sector pulled in a combined £27.4 billion in funding, with the average amount raised per company being £9.6 million. This is according to research from Bowhurst and published by the Startup Coalition, a representative body for the digital economy and startups in the UK. They've published a report they call "Taking Temperature of the UK Health Tech." Includes firms in an index which includes AI, health analytics, biotechnology, diagnostics, and among them they pulled in £865 million in grant funding and employ almost 30,000 people in the UK. Perhaps no one will be surprised that biopharma was found to be the most valuable and populous of the sub-verticals within that index, with 276 companies collectively raising 11.9 billion up to the end of 2024. Really quite a few headline bits out of this, but I think one that we can all get behind is the outcomes from all of this, which is that the number of firms in the index that are reaching an exit stage is almost triple that of the ones that shut down entirely. So 168 firms exiting, 61 shutting down. So really positive news, I think. Ultimately, I have a couple of questions. There's a few recommendations that we can get to towards the end. My first question is, are we being generous by including biopharma in the health tech as a sub-vertical? Or it feels like it's its own thing, surely.
It's funny you mentioned that, Hugh, because I was going to pick that out as a point, just because when I think of health tech, so my immediate thoughts on reading this was I love to hear it. I love to hear about the UK doing well in health tech, and I was thinking about why and the NHS, and almost linking a little bit to the first story about we have this infrastructure which allows an opportunity to integrate technologies to the public in quite an effective way when we do it correctly. And having the NHS infrastructure gives that kind of unique position of the UK to be a leader in health tech, jointly obviously working with pharma and commercial and all of that. But obviously the biopharmaceuticals was still the most valuable and populous, as they say in this article, raising 11.9 billion. So that's still potentially looking at the other global markets, sort of beyond the UK, and how that impacts the kind of therapies we're making. But I think Yeah, I think it's an ongoing question whether we can include biopharmaceuticals in health tech. I think we can, but maybe there does need to be a bit of a differentiation point, um, maybe within that category itself, to actually identify what is the technology part, because some biopharma companies, they don't, like, it's more of a biological focus, and they don't have so much on the AI side, for example, but some do. So I don't know, maybe there's a bit more differentiation within that, how we define what actual health tech is. Maybe that's actually a bigger question of what the word technology actually means, or what health technology means, because you could go into that in a lot of detail, and science in itself, technology. Yeah, now I'm getting confused even thinking about it.
We're going to end up reopening the whole biotech versus tech bio chestnut in the last hour of this
Yeah.
podcast, aren't we? Like, that's just the next hour. Stay tuned. It's going to be great fun. Promise we won't. It's not semantics, but it's not the time either. Um, I think there is another part of this, which is, I mean, if you, it's not just a kind of, oh, is this the right words? Is this the right, can we include biopharma in this? I genuinely wonder whether, if you're a health tech or a med tech company, or someone working in the software space, um, whether this report feels, whether something like the headline reports feel relatable at all. Like, if we look at an average amount raised per company of £9.6 million, that's an impressive number by any stretch, right? But one of the, like, when the biopharma ones are raising the most, and we see like the top raise something close to 500 million for an Ozempic competitor, for the kind of more software, health tech, SaaS, NHS software services, I, I think some might be reading this and being thinking, okay, yeah, I get the recommendations, but I'm not sure I see quite as much of the positives. We've seen a lot of companies struggling over the last year with that kind of direct to NHS model, and challenges around that. And I think things are shifting. We've seen some really, really great raise stories over the last 6 months. But does it feel relatable to the core health tech um, market?
Yeah, those were my thoughts, sort of along those lines as well. I mean, when you think of health tech and you think of those more, yeah, maybe service or delivery, as you said, SaaS platforms, NHS. It doesn't feel like, when I first read it, I was like, oh, great, and then you read and you're like, oh, okay, biopharma, fine, but that maybe it is missing out a little bit of a story, like the context about the other types of companies operating in that space, and maybe that's something to consider in terms of, if we're talking about the UK specifically, challenges in the UK. It depends if we're talking about global markets and, success there, or, the challenges that kind of everyday people are facing, and strains and burdens on the NHS and those models in terms of selling there. So yeah, I'd be interested to see this article written again, but yeah, perhaps not including biopharma in that category, and seeing then the numbers and the results that have result from it. I think that would be quite interesting.
Definitely, and I think it is really good that these that there is someone championing the sector like this, and pushing forward. And I think even with our questions on linking biopharma and health tech, I think these are positive numbers for a sector that I think has struggled in the last 2 years, and has had some negative stories to go along with some of the more positive ones. Let's talk about the recommendations from this report. So there's kind of three core things that Startup Coalition have come out with here. One, reforming procurement to encourage adoption of innovation, and that's very much focused on the NHS and public health space. Two, scaling existing NHS accelerator programs and improving coordination so that we can adopt and scale faster. And then three, encouraging university spin-outs and technology transfer by advocating lower equity stakes for the universities themselves, and incentivizing the founders and future investors for those spin-outs. I think there's lots of interesting things in here. Reforming procurement, it's obviously absolutely essential. Something that I think we've been the sector has been campaigning for a while around. I'd add probably improving evidence generation as well, and looking at the NHS to kind of understand, what it is that they're actually where health tech companies that are coming in are actually benefits and creating the evidence that does support these procurement decisions at scale and adoption. But what are your thoughts on these three, Holly, Amy?
Well, I think the recommendations are actually, it's nice to see those aspects included, that it's not just, for example, it's not just focused on spin outs of universities, but it's actually thinking about the practical uh, integration of the technology, which, as we all know, is a key part of moving those products and solutions to people that actually really need them. It's really nice to hear that and to see that that's a focus of procurement, and the policy side of things. I think there's still, obviously there are still so many hurdles that we have to overcome with that integration piece, and also the funding, about where the funding for that will come from and how, because I think that's a big question, obviously, in how the government plans out the road ahead, and that pathway for digitizing the NHS and adopting these technologies. I think everybody wants to do it. We all want that. We all want to improve procurement, but it's about, the other factors that are going to potentially get in the way, and then how we kind of overcome those. But all in all, I think it's a positive piece, and it's really nice that the UK is, or that people in the UK feel like there's a sense of ownership around health tech, and that it's something that we can be really proud of, and generate that excitement to have something that we're really excited about, and people are positive about, because there's that buy-in that we'll need from patients and people, as well, as especially as new technologies are adopted and there are new systems and different ways of working which people may not be used to. So the buy-in's important, and it's nice to see that kind of, gathering that momentum, that the UK is gonna be a leader in this, and we're gonna do it really well. So I think it is positive. Obviously, there are hurdles, we know that, but it's nice to see.
I think that's a rousing end that we can bring the podcast to a close on. Amy, Holly, thanks so much for joining me and chatting through these stories. For anyone listening, you can find the stories we've discussed, as well as some of the best jobs, pods, and events in health tech in the newsletter at healthtechpigeon.com. Thank you so much for listening. We'll see you next week.